What would you do if a heart attack struck while you were home alone? It's a terrifying thought, but in the few minutes it takes to watch this, 12 seniors will face that exact crisis. Most will be alone. I'm Dr. William Carson. After 40 years in cardiology, I'm sharing the 7-step survival protocol that saved my patient Arthur's life last summer. This isn't just advice, it's the difference between life and death. Stay with me. Let's ensure you always have the power to survive. Step number 1. Recognizing the silent signs. The biggest mistake I see seniors make is waiting for what I call the Hollywood heart attack. We have all seen the movies where a person clutches their chest in agony and collapses to the floor. But after 40 years in medicine, I can tell you that real life is much quieter and that silence is often deadly. For many of us over the age of 60, a heart attack does not announce itself with a bang, but with a whisper. As we cross the age of 60, our nervous systems undergo a natural change. Our nerves become less sensitive, meaning the heart can be in deep trouble without sending a single sharp pain to the chest. For many of my female patients, the heart cries out for help through the stomach or a sense of overwhelming fatigue instead. This happens because an aging cardiovascular system often masks pain signals while it is struggling to keep blood moving to your vital organs. It is a biological trick of the body that we must learn to outsmart. You might mistake these signs for a mild flu or just a bad night of sleep. You might feel a sudden, profound exhaustion that makes your arms and legs feel like heavy lead. You could notice a cold, clammy sweat even while you are sitting comfortably in your favorite living room chair, or a strange, nagging ache in your jaw or back that just will not quit. These are not just the normal aches and pains of getting older. These are signs of a heart under extreme pressure. The American Heart Association has found that nearly 40% of seniors experience these silent symptoms without any chest pressure at all. This was exactly what happened to my patient Margaret, who is 83 years old. She nearly went to bed for a nap because she felt dizzy and tired, never imagining her heart was actually failing. She had no chest pain whatsoever. Thankfully, her neighbor stopped by, recognized her pale skin, and called for help just in time. Please, listen to your body. If you feel unexplained fatigue, sudden shortness of breath, or cold sweats, do not wait for the chest pain to start. Trust your gut, not just your chest. If something feels wrong, it probably is. Your intuition is your most valuable tool during a crisis. Pay attention to these subtle whispers before they become a roar. Your survival depends on acting quickly while the symptoms are still quiet. Do not let silence be the reason you wait too long. Step number 2. Call 911. Never drive yourself. The second step in our survival plan is perhaps the most important rule of all. You must call 911 immediately, and you must never try to drive yourself to the hospital. I know many of you are fiercely independent. You have spent your whole life taking care of things yourself, and you don't want to be a burden or cause a scene with sirens and flashing lights in your driveway. But when your heart is in trouble, that independence can become your greatest enemy. From a medical perspective, your heart is already starved for oxygen during an attack. When you get behind the wheel, your brain requires an immense amount of blood flow to focus on the road, and your muscles need it to steer and brake. This effectively steals oxygen away from your struggling heart muscle at the exact moment it needs it most. For those of us over 60, our bodies do not have the same cardiovascular reserves we once had. The sheer stress of navigating traffic creates a massive surge of adrenaline and cortisol, which can actually trigger a fatal rhythm. You might feel like you can make the trip, but heart symptoms are unpredictable. You could experience sudden tunnel vision, extreme lightheadedness, or a total blackout in a matter of seconds. This is exactly what happened to my patient Franklin, a brave 76-year-old. He felt a heavy pressure in his chest and decided he could make the quick drive to the emergency room himself. Halfway there, he lost consciousness and crashed his car into a telephone pole. He was lucky to survive the accident, let alone the heart attack. The American Heart Association reminds us that for every minute treatment is delayed, more heart muscle dies permanently. Remember that medical care does not begin at the hospital doors. It begins the second the paramedics walk through your front door. They carry life-saving tools, oxygen, and heart monitors that can stabilize you right there in your home. So please, stop what you are doing. Reach for your phone and dial 911 first. Tell the dispatcher clearly that you are a senior experiencing heart attack symptoms. After you hang up, unlock your front door so the first responders can get to you without delay. Please comment the words, "Stay safe" below if you promise me right now that you will call for professional help instead of reaching for your car keys. Step number 3. Chewing aspirin correctly. Now, let us move to the third vital tool in your survival kit. Most seniors I know keep a bottle of aspirin somewhere in the house. This is an excellent habit. However, when a real emergency strikes, almost everyone makes the same critical mistake. They reach for the pill, grab a full glass of water, and swallow it whole. In a normal situation, that is fine. But during a heart attack, that one simple act could cost you your life. Here is the medical reality that every senior must understand. A heart attack is almost always caused by a blood clot blocking a major artery. Aspirin is what we call an antiplatelet agent. It works by making your blood less sticky, which prevents that life-threatening clot from growing any larger while you wait for the ambulance. But as we get older, our digestive systems naturally slow down. When you swallow a pill whole, it must travel all the way down to your stomach, dissolve, and then pass through your liver before it ever reaches your bloodstream. This slow process can take 30 minutes or even longer. In a cardiac crisis, 30 minutes is an eternity. We need that medication in your system immediately. By chewing the aspirin instead of swallowing it, you break the tablet down into a fine powder. This allows the medicine to be absorbed through the tiny, sensitive blood vessels under your tongue and in the lining of your mouth. This technique bypasses the slow journey through your gut and gets the aspirin to your heart in as little as 5 minutes. The scientific proof is undeniable. Data published in the Journal of the American College of Cardiology shows that taking aspirin during a suspected heart attack can reduce the risk of death by 23%. However, those life-saving benefits depend entirely on speed. Waiting 30 minutes for a swallowed pill to work could mean the difference between a minor recovery and permanent, major heart damage. I think of my patient Dorothy, a wonderful 68-year-old woman. When she felt that telltale pressure in her chest, she was smart enough to reach for her aspirin. But because she was so used to her daily routine, she swallowed it with a glass of water, just like she did with her morning vitamins. By the time she reached the hospital, the blockage had progressed significantly. She told me later with tears in her eyes, "Dr. Carson, I thought I did everything right, but I just did not know about the chewing." So, here is your life-saving instruction. The moment you suspect trouble and after you have called 911, take one full-strength 325 milligram adult aspirin. If you only have the low-dose baby aspirin, take 4 of the 81 milligram tablets to reach the correct dosage. Do not swallow them whole. Chew them thoroughly until they are a paste and swallow with only a tiny sip of water if necessary. Please, go to your medicine cabinet today. Check the expiration date on your aspirin. If it is old, throw it out and buy a fresh bottle of the non-coated variety, as these are much easier to chew. Keep a few tablets in your nightstand, in your purse, or even in your wallet. While a heart-healthy diet full of fruits and vegetables is the best way to prevent disease, in the middle of a heart attack, You need the immediate power of this medication. Be prepared, be fast, and always remember, chew it, do not just swallow it. Step number 4, the survival posture. Once you have called for help and taken your medicine, the next thing you must do is position your body correctly. There is a very common instinct to lie down flat on the floor when we feel a heart attack coming on. We think we need to rest or that lying down will help us stay calm. But as a doctor who has spent 40 years treating aging hearts, I need to tell you that for a senior, lying flat is one of the most dangerous things you can do during a cardiac event. Let us look at the science of why this matters so much. When you lie down flat, your internal organs in your abdomen actually push upward against your diaphragm. This puts immense pressure on your heart and makes it much harder for your lungs to expand to their full capacity. As we age, our lungs naturally lose some of their youthful elasticity, and our heart valves can become a bit stiffer. We simply do not have the same ability to handle the shift in fluids that occurs when we go from standing to lying flat. If you lie down during a heart attack, you might experience a terrifying symptom called orthopnea. This is a feeling of smothering or suffocating, almost as if someone is sitting on your chest. You might find yourself gasping for air, even if the windows are wide open. This happens because your heart is too weak to pump efficiently, and fluid begins to back up into the small air sacs of your lungs. The scientific proof for this is well established in every emergency room in the country. Medical protocols for acute cardiac events always prioritize what we call the high Fowler's position. Clinical studies show that sitting upright at a 90-degree angle or slightly less improves your tidal volume, which is the amount of air you can move in and out of your lungs with each breath. By sitting up, you are using gravity to your advantage, allowing your organs to drop away from your chest and giving your heart the room it needs to breathe. I remember my patient Robert. He was alone in his living room when he felt a sudden crushing weight on his chest. His first thought was to lie down on the rug and wait for the pain to pass, but as soon as his back hit the floor, he felt like he was drowning. He remembered our talk from his last checkup and managed to pull himself up against the base of his sofa, propping his back upright with several firm cushions. By the time the paramedics arrived 10 minutes later, his oxygen levels were still stable. He survived because he refused to stay down. So here is your life-saving instruction. Stop yourself from lying down on a bed or the floor. Instead, find a sturdy wall or the front of your sofa. Sit down on the floor with your back firmly supported and upright. This is the high Fowler's position. Bend your knees slightly to take the strain off your lower back and keep you from sliding down. While you are in this position, take a moment to noi long your clothing. Reach down and unbuckle your belt. Unbutton your collar. If you are wearing a tight vest or a tie, remove it immediately. You want your chest and your belly to be as free as possible so that every breath you take is easy and unrestricted. While we often talk about the role of healthy movement and exercise, in this specific moment, the best thing you can do is stay perfectly still in this upright posture. By sitting tall and loosening your clothes, you are giving your heart the best possible chance to keep beating until professional help arrives. Step number 5. The panic switch. Now we must address the invisible enemy that attacks the very moment you realize you are in trouble. That enemy is panic. When we are scared and alone, our bodies naturally release a massive flood of adrenaline. We call this the fight or flight response. But for a senior heart, this rush of adrenaline is like pouring gasoline on a fire. It forces your heart to beat even faster and burns through the tiny amount of oxygen that is left in your heart muscle at a time when every single drop of oxygen is precious. This is why I tell all my patients that you must learn to flip the panic switch. As we get older, our hearts are much more sensitive to these sudden spikes in stress hormones. If you allow the panic to take over, your blood pressure will skyrocket and your arteries will constrict further, making the blockage even more dangerous. You might feel your heart racing like a hummingbird, or you might start to breathe very quickly and shallowly, which only makes the chest pain feel more intense. The solution is a simple biological override called the 4-7-8 breathing technique. By controlling the rhythm of your breath, you are sending a direct signal to your brain to activate the parasympathetic nervous system. This is your body's natural braking system. It tells your heart to slow down, it lowers your blood pressure, and it allows your body to use its available oxygen much more efficiently. It is like taking a deep, cooling drink of air for a heart that is currently overheating. Research published in the Journal of Emergency Medicine confirms that these controlled breathing techniques can actually reduce your perception of pain by nearly 28% during a cardiac event. This is a powerful tool that requires no equipment, costs nothing, and can be started in a matter of seconds. It gives you something productive to do while you wait, which naturally lowers your anxiety. I think of my patient Eleanor, a kind 71-year-old woman. When she began to feel the signs of an attack, she called for help, but then the ambulance got stuck in heavy afternoon traffic. Instead of letting the fear consume her, she focused entirely on her breathing. She counted every inhale and every exhale. When the paramedics finally reached her, they were amazed at how calm her vitals were despite the situation. Eleanor told me later, "Dr. Carson, the fear was trying to swallow me whole, but that breathing gave me an anchor to hold on to." So, here is your life-saving instruction. While you are sitting in that upright position we discussed, place the tip of your tongue against the ridge just behind your upper front teeth. Close your mouth and inhale quietly through your nose to a mental count of 4. Then, hold your breath for a count of 7. If you are struggling for air, just hold it as lead as you comfortably can. Finally, exhale completely through your mouth, making a gentle whooshing sound to a count of 8. Repeat this cycle at least 4 times. Focus only on the numbers and the sound of your breath. By choosing to breathe this way, you are taking back control from the fear. You are protecting your heart muscle and buying yourself more time. Remember this, in the middle of the storm, your breath is your anchor. Start practicing this technique tonight while you are healthy, so that it becomes second nature if you ever truly need it. Your breath can be the bridge that gets you safely to the hospital. Step number 6, self-administered chest compressions. Now, we come to the part of our survival plan that I truly hope you never have to use. This is the absolute last resort for the moment when you feel the darkness closing in and you realize you are about to lose consciousness. If you are alone and you feel yourself fading, your only goal is to buy your brain and heart just a few more precious seconds of oxygen. As a cardiologist with 40 years of experience, I know this technique is often debated in medical circles. Some doctors worry about the risk of broken ribs, especially for seniors with thinning bones. But I have always told my patients that a bruised or cracked rib is a small price to pay for a heart that keeps beating. When the alternative is a fatal cardiac arrest with no one around to help, you deserve every possible fighting chance. By manually pushing on your own sternum, you are creating a small amount of artificial circulation. While it is not as effective as professional CPR, it can keep a tiny but vital stream of blood moving to your brain. You will know it is time for this extreme measure when you feel a sudden, heavy coldness and your vision begins to narrow. This is the sign that your heart is no longer pumping enough blood to your head. This was the exact situation my patient George faced last winter. He was alone at a remote cabin when his world began to spin. He did not wait. He moved off his soft armchair and got himself onto the hard wooden floor. He used his own hands to pump his chest with every ounce of strength he had left. That action kept him conscious just long enough for a neighbor to hear his radio and check on him. George told me that those few forceful pushes were the most difficult thing he had ever done, but they are the reason he is still alive to see his grandchildren. If you find yourself in this desperate situation, here is exactly what to do. You must get onto a hard surface, preferably the floor. Make a firm fist with one hand and place the knuckle side directly in the center of your chest. Use your other hand to push your fist down forcefully into your breastbone. You must aim for a depth of about 2 inches and maintain a rhythm of 100 compressions per minute. Keep the beat of the song staying alive in your head and do not stop until help arrives. This is your final line of defense, a powerful tool for a desperate moment that could truly save your life. Step number 7, your personal battle plan. We have covered a lot of ground today, but none of these steps will work if your mind stops functioning in the heat of the moment. The final and most important piece of our survival protocol is the creation of your personal heart attack action plan. I have seen it happen hundreds of times. A perfectly capable and intelligent person suddenly finds themselves in pain, and they simply freeze. They cannot remember their daughter's phone number. They cannot find where they put the aspirin. They even forget their own address when the 911 dispatcher asks for it. There is a very real medical reason for this. During a cardiac event, your brain suffers from a sudden drop in oxygen and blood flow. Your body enters a state of shock, diverting resources away from your higher thinking centers to keep your vital organs alive. For us seniors, this cognitive impact is even more pronounced. We call it the cognitive freeze. It is not a sign of weakness or old age. It is a biological reaction to trauma. This is why you must think now, while you are calm and sitting in your favorite chair, so that you do not have to think when your life is on the line. I want to tell you about my patient Martha, a sharp and active 79-year-old. 6 months before her emergency, we sat down and wrote out her battle plan. She created a simple medical information card and taped it right to the front of her refrigerator with a bright red magnet. She included her medications, her allergies, and her son's cell phone number. When her symptoms started, Martha told me her brain felt like it was filled with thick gray fog. She could barely remember her own name, but she did not need to think. She simply followed the red magnet. The paramedics were able to see her heart history the moment they walked into the kitchen, which saved nearly 10 minutes of questioning. Those 10 minutes are the reason Martha is still with us today. So, let us build your plan right now. First, you must create that medical ID card. Use large, clear letters. Place one copy on your fridge and keep another in your wallet. Second, you must place your aspirin in strategic locations. Do not keep it tucked away in a high cabinet. Put a small bottle on your nightstand, one in your purse, and one by your recliner. Third, go outside and look at your house. Are your house numbers easy to see from the street? If not, buy large reflective numbers today. Paramedics often lose precious minutes driving up and down a dark street trying to find the right door. While a diet rich in leafy greens and lean proteins is the best long-term plan for your heart, your immediate survival depends on this physical preparation. Please, do not wait until tomorrow. Take 5 minutes this afternoon to set up your ice contacts in your phone and check your house numbers. By preparing this battle plan in advance, you are not living in fear. You are taking control. You are ensuring that even when your mind is clouded by pain, your plan will be there to lead you home. Arthur is back in his garden today because he had a plan. He did not survive by luck, but by preparation. Remember, knowledge is the medicine that saves everything. In the comments below, tell me one small change you promise to make today. Will you move your aspirin or update your medical card? If this helped you, please subscribe to join our community of friends. Share this with someone you love. I am Dr. William Carson. Stay safe and have a heart-healthy day today.